Welcome back to What Your GP Doesn't Tell You, the podcast for both doctors and patients with me, Liz Tucker. In this week's episode, I'm talking to Kerry Bone. Unusually for this podcast, he isn't a doctor, but a herbalist, and has spent 40 years working in the field. I heard Kerry speak at the Integrative and Personalised Medicine Congress in London last year. I wanted to get him on the podcast because today we are bombarded with confusing information telling us what to eat, when to eat, and often how certain herbs and spices are particularly beneficial to our health. So I wanted to find out what the evidence is for using medicinal plants. So I hope our conversation gives an opportunity to find out. And Kerry also discusses how long-term popular non-steroidal anti-inflammatory drugs such as ibuprofen actually in the long term increase low-level inflammation, and that in fact aspirin is the only medication in this class that reduces inflammation both in the short and long term. He explains why he thinks we should also be looking more at herbal alternatives such as curcumin and Boswellia, and reveals what he takes every day. But before we get to Kerry's interview, a brief request from me. If you enjoy this podcast and would like to leave a review on Spotify or Apple, that would be much appreciated. It really helps. You can also become a paid supporter of the podcast at patreon.com/whatyourgpdoesn'ttellyu or via PayPal on my website, whatyourgpdoesn'ttellyu.com. A huge amount of work goes into both the research and production of this podcast, so even a small amount of money makes a huge difference. And you can find out more information about the pod on my website, where you can sign up for the podcast mailing list, follow me on Twitter at Liz C. Tucker, and on my Substack account, liz.tucker.substack.com. Many thanks. And now back to Kerry's interview. Kerry Bone is the principal of the Australian College of Phytotherapy. He also founded the Masters of Health Science Herbal Medicine course at the University of New England in 2004 and served there as Associate Professor from 2004 to 2012. He's co-author of more than 40 scientific papers on herbal research and currently serves on the editorial board of the journal Phytomedicine. In addition, he's written a number of textbooks on herbal medicine and is also a co-founder of the company MediHerb. Here's Kerry's interview. So, Kerry, thank you so much for joining the podcast today.
Thank you, Liz. Pleasure to be here, and thank you so much for inviting me.
I think from a lot of the public, there's increasing interest in the use of herbs and spices to help improve our health. But a lot of health professionals would say that there still isn't a great deal of evidence for this.
Well, I'd say they're not reading the literature. It's as simple as that. But I think we need to understand where some of these people are coming from. So some people are applying the same standard of evidence for a drug, a herb and a spice. So we need multiple studies, millions of dollars spent, double-blind clinical trials in abundance. But in reality, that's not needed, because the reason why that barrier is set so high for drugs is that these are chemicals that are alien to human metabolism. There's no history of use. So naturally, we're going to want to be, firstly, absolutely sure they're safe. And as we sadly know, in many, many cases, they are not. But we also, it's a risk-benefit balance. So we also want to know that there's a huge benefit because there's a risk with these alien chemicals. Now, when it comes to herbs and spices, we've been consuming them for millennia. Chimpanzees medicate themselves with herbs. So we need some indication of benefit. We need some understanding of how it works, and that I call biological plausibility. But that's really all you need, because there's a recent study, a study from China, that did a meta-analysis of mushroom consumption and cancer risk. And they found that if you start eating up to any sort of dietary mushroom, if you start eating up to around 50 to 100 grams a day, you will overall, across the board, halve by 50% your risk of cancer. So imagine if there was a pharmaceutical that reduced the risk of 50% for cancer. You know, the company that produce that would probably have a value bigger than the UK's GDP.
But even in the case of a meta-analysis, quite often we have cases of correlation rather than causation. There can be all sorts of factors going on. So, for example, a study might show that if people have too much sleep, they may be more likely to die early, for example. But it might be that if you're ill, therefore you're sleeping more. These correlations versus causation can be complicated.
Yes, we should do some prospective studies, but is a mechanistic understanding of how mushrooms do this. And this is based on very solid science. So we come in with the biological plausibility that I mentioned at the beginning. But the way the mushrooms do this is that the beta glucans in the mushroom fruiting body interact with receptors called dectin-1 receptors, and they stimulate a certain pathway in immune cells. Now, that same pathway that gets stimulated is also the same pathway that gets stimulated with immune surveillance for cancer cells. Same pathway. So yes, I must admit I was a bit skeptical about the mushroom cancer prevention connection until the discovery of dectin-1 receptors. And that's only 14 or 15 years old. So that gives all of this a huge biological plausibility. Plus, there are now clinical studies. There's an organization called the Hope Institute in the US that's studying mushrooms and mechanisms in cancer in patients, in clinical trials, finding these same observations of a greater immune surveillance, greater immune stimulation. So I come back to my point that I think a lot of this literature is being ignored because the standard applied is too high. And by the time we wait for the kind of evidence that some of these skeptics are demanding, we'll all be dead.
If someone is facing a life-threatening illness, you want to be extremely sure that if you're going to take a new treatment, it works. So it seems to me, therefore, not surprising.
I disagree, because if they did that at the exclusion of everything else, yes. But if they do that in addition to everything else, where is the harm? Where's the risk? The answer is no risk. And yet I have oncologists that tell my cancer patients, don't take mushrooms. And they haven't read any of the literature. They just do it out of, I guess, I don't know, fear of the unknown. Who knows?
I suppose the other side of this, before we get into more of the details about what herbs and spices actually do.
Yeah.
Just because something is natural doesn't mean it can't also cause side effects. So, for example, someone contacted me some time ago about some really nasty side effects they'd had from lion's mane. And after all, many drugs derived from natural components. So just because something is a naturally occurring spice or herb, therefore there aren't any side effects.
Well, absolutely, but it depends on how you use them, and it's all relative. So the risk of side effects is way, way down. So let me say this. I have now been in continuous herbal practice for 40 years. I have never experienced one serious side effect in a patient in 40 years of continuous clinical practice. My insurance for $10 million cost me $240 a year. Now, insurance companies, they know the data. So why is my insurance so cheap? It's because what I'm giving is largely harmless. So yes, I'm not saying herbs are without risk, and I'm not saying that often you need professional advice to manage that risk. But again, I feel that the risk associated with herbs and medicinal plants and even spices is exaggerated. And sometimes it's being exaggerated by ignorance, and sometimes it's being exaggerated by vested interests.
I suppose there's a difference, isn't there, between using herbs and spices in the proportion that we use in our cooking and when one starts to use them in a medicinal sense.
Not necessarily. Often the same amount that you will use in cooking is the same amount that delivers a therapeutic effect. And three of the ones we can talk about, which are garlic, cinnamon, and black cumin or nigella, the therapeutic amounts that have been shown to be effective in clinical trials are exactly the amounts that you might use in cooking. Certainly in the case of cinnamon, maybe towards the higher end, and maybe in the case of black cumin, but certainly amounts that are consistent with normal dietary consumption.
I mean, I've taken turmeric for pain relief, which I found quite effective, actually. But when I do take it, I'm taking it in a higher dose than I would be using in my cooking, for example.
Oh, absolutely. In that case, you have to. And what I do and a lot of practitioners do and a lot of companies make is forms of the active component of turmeric, or the key active component, which is curcumin, with enhanced bioavailability, because curcumin is not that well absorbed in the body. And so there are numerous companies that now have products that have been developed with technology to enhance the bioavailability of curcumin. As I point out to my patients, the equivalent of one capsule of such a product would be about 300 grams of turmeric.
Which wouldn't do much for the taste of your curry, probably.
No.
One of the things that you've talked about, and I'd like to look at in a little bit more detail, is the way certain herbs and spices can help our cardiometabolic health. What are the potential mechanisms by which they might do this?
Fundamentally, I think many of them affect insulin resistance. So we know that a lot of cardiovascular poor health is driven by insulin resistance. It's kind of a pre-diabetic state, or even type 2 diabetes, where the body is producing insulin, but the response of the target cells is lower.
At this point, somebody's blood sugar has gone up so much, the body is producing more and more insulin, and there becomes a point where this is no longer effective in reducing our blood sugar levels.
Yeah, because the responses of the target cells like muscle tissue, etc., and liver is reduced for whatever reason. There's a lot of debate about what drives insulin resistance, and it's by no means fully solved. But one thing that appeals to me, because I believe this is a key area where herbs and spices act, is the microvasculature. So insulin is a fairly large molecule, needs to get access to tissue. So for a fairly large molecule to get access to distant tissue, it needs to be carried effectively through the circulation and then diffuse out. So if your microcirculation is below par, the insulin is not going to reach its target. And there is a fairly strong school of thought that microvascular damage, eyes and kidneys, that's associated with insulin resistance is not just a consequence of insulin resistance, it may indeed be a cause as well. So that's one aspect. The other, they often correct dyslipidemias, so triglycerides, cholesterol, so blood sugar, insulin resistance, dyslipidemias, and blood pressure. Most of these agents will have an impact on blood pressure, and indeed, in a small way, they can even impact body weight.
How might they work on blood pressure?
I don't think it's understood, to be honest, and I think the mechanism would vary from herb to herbs, but possibly relaxing blood vessels again, there's some impact on blood vessels and blood vessel function. I think we have a reasonable understanding of garlic, but it's no doubt going to be much more complicated than this, but this will give some insight. If we look at the functioning of the fine circulation, because the responses need to be quick and transient, the body uses gaseous messengers, in other words, gases that diffuse just locally, act quickly, and then diffuse away to enable these fine-tuned microvascular responses. Key one there, of course, is nitric oxide. The best way to enhance your nitric oxide, especially as you get older, is dietary nitrate, which you can get from beetroot in particular, but green leafy vegetables, spinach, etc. But there's another gaseous messenger, like nitric oxide, in higher doses would be toxic, but at these exquisitely low and subtle release levels is beneficial, and that's hydrogen sulfide. And it's been shown quite clearly. There was, I think, a breakthrough study that happened, published about 15 years ago, that shows that garlic consumption enhances your hydrogen sulfide production. So you're getting that microvascular regulation of blood flow, and that ultimately will reflect back on lower blood pressure, because it's been shown that nitric oxide lowers blood pressure. For example, there was a Scottish scientist, I think he was British, but he was working in Scotland, who found that if people go out into the sun, it lowers their blood pressure. Reason? We've got all this nitrate stored just under our skin. Under the action of sunlight, that nitrate converts to nitric oxide, and up goes your nitric oxide, down goes your blood pressure.
And I suppose if you go out for a walk or something, that might make you feel a bit more relaxed as well.
Yeah, indeed.
So in terms of the mechanism by which herbs and spices might help regulate insulin resistance, I did see one suggestion, which has also been a new pharmaceutical target, which was PDP-1B.
Yeah, you have to be careful about such studies. And the reason is herbs are chemical soups. and they are processed in variable ways by the body. So if you make a herbal extract in a test tube and you dilute it and then expose it to certain receptors and say, look, we're getting an effect, that's not necessarily reproduced in the body because there's the intervention when we ingest a herb and a spice of the gut microbiota, number one, and secondly, of the capacity for absorption or not absorption. So what is actually absorbed into the bloodstream? I've actually been involved in published studies on this. It can be quite different to what's in the crude herbal extract. I have a saying, in vitro non veritas. When it comes to herbs, test tube studies, with a few exceptions, if it's on the skin, test tube model it on skin cells, that probably works. And maybe something in the stomach and upper digestive tract. Again, there's direct contact, so a test tube model will reflect what happens in the real world. But herbs are phytochemical soups which are modified by our gut flora and have variable absorption. So what actually gets absorbed is quite different to what is in that extract. And here we touch on a point that is relevant to your question, and that is many of the phytochemicals in herbs, and we can even call them phytonutrients. So what is a phytonutrient? Maybe we can pick up on that later. But many of the phytonutrients that are in herbs and spices actually act as prebiotics. So it's not just fiber that acts as a prebiotics and alters your gut flora and feeds certain healthy bacteria and not others. Many of those key phytochemicals are prebiotics. And I think that's possibly one of the key ways they affect insulin resistance because they're modulating gut flora.
Well, now's as good a time as any. Do you want to explain what a phytonutrient is?
Yes. So, I read studies. Someone says, green tea has shown these beneficial effects. It's full of antioxidants. So you'll see that everywhere. This herb is beneficial because it's full of antioxidants. One would think that antioxidation was the key to everything, but in actual fact, it's the key to nothing because when it comes to plants, it's a meaningless concept because plants are out there in the sun all day. They're full of antioxidants, any plant. So if you want antioxidants and you think that's the benefit, just go eat your lawn clippings. So a far better terminology to use is phytonutrients. So what are phytonutrients? They're phytochemicals, i.e. plant chemicals, that we consume via the diet, fruit, vegetables, herbs, and spices, that are important and have been shown to be important for optimal health and aging. So a deficiency of them might not cause a disease, so they're not vitamins in that sense. But what they can do if you have more of them is they can optimize your health and they can optimize your healthy aging.
You mentioned that one of the things that herbs and spices can do is help control our lipid metabolism. And I saw a suggestion that was because bioactive components from spices can reduce lipid accumulation in fat cells.
Again, I think we shouldn't jump to any conclusions. It's probably test tube experiments. I would say it's more about lipid processing than anything else. And again, I think it's possibly mediated by gut flora interactions, maybe reduction in liver fat, that sort of thing. There are some mechanisms of how things work for phytonutrients, herbal actives that are robust and others that are speculative. And case in point that you can test tube model a herbal extract against cancer cells and the cancer cells might stop growing. And when you look at it mechanistically, you can find at least 8 or 10 different pathways as to how this might occur. But the reality is that none of those actually apply in a real life situation.
So in terms of the impact that different herbs and spices can have on our cardiometabolic health, which do you think have the strongest evidence?
I think the three I mentioned, garlic, cinnamon, and black cumin nigella, they have the strongest evidence. Now, the cinnamon research has been confounded by issues with quality and species identification because there are 3 key species of cinnamon. So there's the true cinnamon, which is the Ceylon cinnamon, there's the Indonesian cinnamon, and then there's the cassia cinnamon that's used in India and China. The balance of research seems to now be supporting more the traditional cinnamon that we have, in the quills, the Ceylon cinnamon Zeylanica, and Zeylanica is for Ceylon or Sri Lanka. That appears to be the best form.
Obviously, we can't give individual medical advice on this podcast, but typically, in terms of dosage, what might be the sort of levels that people would look to take of these herbs and spices?
Garlic, about a fresh clove a day, and that's what I try and do. And some of my cloves are quite large. Fresh crushed raw. I portion out the hummus that I'm going to eat, for my lunch, and I will crush a clove of garlic into it, mix it in, and eat virtually right away. So that's the garlic, about 1 clove a day. The cinnamon, it's about a couple of grams, about a rounded teaspoon of powdered cinnamon. And the nigella, again, it's about 1 or 2 grams, so similar, about a rounded teaspoon.
You can also buy nigella seeds in little sort of tablet form, can't you?
You can get it in tablet form. Also, there's an oil that's produced from nigella seeds, and it's called black seed oil. And that's a fixed oil. In other words, it's pressed out of the seed the same way you press linseed oil out of linseeds. And that's particularly rich in a phytochemical called thymoquinone. And so there's a body of studies on these thymoquinone-rich oils, and there's a body of studies on just the powdered black cumin seed. And generally, unless there are certain specific applications, which given we don't want to make medical recommendations, I won't go into for the black seed oil, you're better off, I think, with just the whole powdered black seed, or even the whole black seed.
You were mentioning earlier that there's some difference depending on what types of cinnamon people use, which have modelled up the results of the study.
Yeah.
So when one goes into the supermarket to buy cinnamon, how do you know what sort you're buying?
Well, if it's in quills, then it's definitely Cinnamomum zeylanicum, the right one. If it's a powder, you don't, because my research team, we at the time, I don't lead a research team now, but I did at the time, we looked at multiple sources of powdered cinnamon and found that the species attribution was generally incorrect.
And if you do have the quills, I have both in my cupboard, actually. I have the powdered cinnamon and also the quills.
Yeah.
It's not going to be very easy to grind up those quills into powder.
Oh, you can put it in a blender.
I think I'd still end up with little shards of bark.
I think you need a new blender.
Now, presumably, in addition to the benefits for cardiometabolic health, these herbs and spices might also have an impact on our gut biome.
Yeah. In science, we use the term crosstalk. So that's where there's a two-way interaction, and it's quite fascinating when it comes to plant chemicals. As I said, they act as a prebiotic and alter gut flora. But in that process, because they're metabolized by the gut flora, get altered themselves. And more often than not, it's the form that the bacteria change that phytochemical into that is the form that is absorbed and is active in the body. So it's this beautiful crosstalk. Any person in clinical practice using these agents like myself sees tremendous variability of results. And I think that variation in gut flora explains in part, perhaps in significant part, that variability of response.
Might there also be variability in the herbs and spices that people are using?
I'm talking about my clinical practice, so what I'm using is consistent.
And there's a suggestion that a process in the cell membrane, which acts as a sensor for various chemical and physical stimuli, like cold temperatures and irritants, etc., may also be involved.
They influence these heat-sensing receptors on cells, the vanilloid receptors they're called, or TRPV1, and they impart a sensation of heat. So we're looking at black pepper, chilies, and ginger. And they, of course, again, have hugely beneficial health effects, including cardiometabolic. So although I gave an earlier list of 3, that list could be much, much longer. It's these hot spices. The ones in ginger enhance gut motility. So if someone's got slow gut transit, they will increase gut transit. I've used it in patients, for example, with the condition known as gastroparesis. And there's clinical evidence to back that up. And it does enhance gastrointestinal transit time. The ones in ginger also have antiplatelet effects, so they have a mild beneficial blood thinning effect. And the ones in ginger are anti-inflammatory. They all have great microvascular effects. The ones in ginger even have antiplatelet effects, so have a slight blood thinning effect. The ones in chili boost metabolism and so can help with weight maintenance and even weight loss. It's quite interesting because when the CBD craze started, there was a well-known herbal expert in the US got up to give a presentation about CBD. He pointed out, and it was to the industry, to all the CBD manufacturers, CBD, the non-psychoactive component of cannabis, pointed out to them that everyone's raving about the role of CBD in pain management, but if you look at ginger, there are actually more than 40 clinical trials of ginger in pain management. And I thought, what? 40? So I went and looked it up, and he was right. There are more than 40 clinical trials of ginger in pain management.
So I sometimes have ginger tea, partly because I like the taste and partly because I think, it might be doing me some good. And I chop up raw ginger and pour boiling water over it. And you certainly can feel quite a ginger kick, but I'm never sure how much ginger I'm absorbing like that.
The reality is if you want a decent amount of these phytochemicals in your system from ginger, you have to either use a herbal extract, an alcoholic extract, or you have to eat the ginger as it is, generally raw. A piece about 1 centimetre cubed would have a significant therapeutic effect.
And there's another area that you think holds great promise, and that is bitter substances. Can you explain what that includes and why they might be helpful?
Well, it's pretty simple. Something that's bitter is exactly that. Tastes bitter when you consume it. So in the old days, before we got so clever, bitters were a very strong part of our diet, mainly because of the vegetables that we consumed. So, for example, I'm sure you may recall having very bitter zucchini or very bitter Brussels sprouts. But what they've done is they've bred that bitterness, these bitter phytochemicals, out of these vegetables over time. And so we're not nearly getting the level of bitter exposure that we did in the past. There's all these negative connotations with the sensation of bitter that we have culturally. Bitter experience, it was a bitter divorce. But in fact, my saying is add bitterness back to your palate to take the bitterness out of your life because of the hugely beneficial effects of bitters. So, for example, in India, they eat the bitter gourd. That's a good example. But generally, if you want bitter exposure, you have to do it by having either bitter herbal teas or various preparations, alcoholic based, that are called amara. So when I was a young herbal student, I went with my herbal teacher, Heinz Zelstra, to a herb fair in Verona, in Italy. And every second booth was some company that wanted you to sample their amora. I mean, hops are bitter. Therefore, we should be seeing tremendous health benefits from beer. But the reality is the level of bitterness in hops now is only a small fraction of what it should be and was in the past for health benefits. So you're getting the negative effects of the alcohol and the carbs and not enough bitters to counter that. So I don't recommend drinking beer unless it's extremely bitter.
Of course, all the modern lagers have very little hops in them, and it's only the more traditional beers. But for example, just speaking as someone who's a bit of a craft ale enthusiast, I wonder if that was likely to do me more good. Obviously, I know not much because there's an awful lot of carbs in that too.
Craft ale is better than a normal beer, but unless it tastes really bitter, bitter enough to make you say, pucker a little bit, then it's not strong enough. Before I talk about what bitters do in terms of their benefits, we should talk about a discovery that, again, has only been in the last 2 decades. So originally it was thought we have taste receptors only on our tongue. The reality is we have taste receptors all through the body, and particularly they are bitter receptors. It's interesting because we have just a few receptors that combine for sweet and a couple combine for umami and just one receptor for sour and one receptor for salty. But we have 25 bitter receptors. and they are distributed throughout the whole digestive tract and elsewhere in the body. Men have bitter receptors on their testes. What the hell that is about? What's realised now is you don't have to taste the bitter to get its beneficial effects because it will interact with the receptors further down in your digestive tract and give those benefits. If you want to look at an area where research has turned our understanding of herbal value and, again, phytonutrients on its head, the bitter research is the exemplar of that. So what they do is they interact with particularly hormonal cells that we have in our digestive tract called enteroendocrine cells. And those interactions stimulate a range of peptides that influence glucose metabolism and appetite and digestive processes. So you digest your food better, you get better laxation, you get better blood sugar control, and contrast to perhaps, the original understanding of bitters was that they stimulated appetite. Bitters actually turn off appetite. And they turn off appetite by exactly the same mechanism as these new weight loss drugs, by stimulating this peptide called GLP-1. So bitters are your natural GLP-1 enhancers. So if you don't want to go injecting yourselves with, Wegovy or Ozempic or whatever, put bitters back into your diet. It will be subtle, but it will still exert a beneficial effect over time.
And the way somebody would have to do that is by buying one of the extracts.
Generally, to get the decent whack, yes. Unless you're fairly hardened and you can go out into a health food shop and buy a really strong, bitter tea full of gentian and wormwood and so on. I mean, our research has shown that feverfew, interestingly, is one of the best GLP-1 enhancing bitters herbs you can have.
Well, that's really interesting because I take a prophylactic combination to prevent migraine. And one of the ingredients in that is feverfew. I have to say it's really effective. I used to get migraines perhaps, once a month or something. And now I rarely get them. And if I do, they're much milder.
Yes, indeed. And that's what's been noted in all of feverfew studies. Now, the interesting thing is no one knows how feverfew does that. And my hunch is it's doing exactly by this mechanism. Because what they're discovering with all the research on, the GLP-1 drugs is, hey, they have all these other benefits because GLP-1 in the right amounts is a hugely beneficial hormone. So it's helping brain health, it's helping kidney health, a whole range of things. And I suspect that's how the feverfew is acting. Just that little nudging increase of GLP-1 increased over time eventually has some influence on the mechanisms that cause migraines.
The thing I take is a combination. It has magnesium and some B vitamins in as well, but hugely effective. For me anyway, certainly.
Yeah.
And Kerry, there's been a study using the bitter extract gentian, which showed promising results in a small group of patients.
I guess I should explain here, I've kind of alluded to it beforehand, that when I'm talking about benefits, all of the benefits I describe are from human studies. So everything I'm saying has some evidence from human clinical studies. Now, they may not be small studies like that one, but that study in case in point for gentian showed a significant increase in GLP-1 output from having gentian versus a control group that didn't. That's also been shown for the bitter herb Andrographis. And there are multiple studies for hops, the bitters in hops, to the point that companies are now selling commercial extracts of hops as weight loss agents purely based on the clinical evidence that they boost natural GLP-1 production.
As we were talking about at the start about various herbs that can stabilise blood sugar, hence potentially perhaps avoid insulin resistance, clearly these would also do that.
Bitters do that as well. Yes, very much so. Via these gut peptides. There's a range of gut peptides. GLP-1 is one of them. They're collectively known as incretins because they increase the impact of insulin in blood sugar regulation. That's how they were first discovered. But they have a range of other benefits as well, including turning off appetite.
The most bitter thing I can think that I eat is chicory.
That would be good, yes.
I can't think of any other food I have which is as bitter as that. And that doesn't seem to have had the bitterness bred out of it.
Yeah, and there are a number of salad ingredients, endive, for example, and others. They can be quite bitter and quite useful. Unless you're perceiving bitterness, you're not getting the benefit. But as I was saying, because the bitter receptors are in the gut, the ones in the gut are what confer the main benefits. You can get a really strong bitter extract, pop it in a capsule or a tablet and take it and be none the wiser as to its bitterness.
So how much chicory would I have to eat to get a therapeutic benefit?
Let me put it this way. If you are left with a lasting sense of bitterness on your palate that would last for, say, 5 to 10 minutes, you've got a therapeutic dose of bitters.
Which is quite off-putting for people, I guess, in terms of getting enough of it.
Hence, use it in extract. But I don't know if it's because I'm been a herbalist for decades or what have you, but I enjoy bitterness. I like bitters. At this point, we should also add that from genetic studies, there are 25 receptors and hence 25 potential points of genetic variation. And it's been shown that people are more sensitive to bitters and some are less sensitive to bitters. And the interesting thing is, across the board, who are more sensitive to bitters, been shown in epidemiological studies to have better outcomes across a range of things, even less cancer.
That's quite a difficult thing to unravel, isn't it? Because there could be so many things going on there.
They're unraveling it. It's just they haven't done enough studies because it's complex. There are many receptors. But where they've been able to unravel it, it's there. As you say, association, not causation, but what's the other explanation?
So how do you incorporate bitters into your life? What do you do?
I take bitter extracts. That's what I do.
And in terms of food?
Not so much via food, no. I mainly do it via herbal bitter extracts.
What are all the things that you take every day?
Or a lot. I take echinacea every day, echinacea roots. I take omega-3s every day. That's not herbal, but I'll give you everything. I take B12 most days. I take quite a bit of ginkgo because I believe it's the best bet for preventing dementia. And I also take bioavailable curcumin, which I think is another really good thing for preventing dementia. I take bilberry every day for the microcirculation. I take olive leaf extract because I think it's anti-inflammatory. Some people say olive leaf is good for immunity. I'm skeptical of that. I don't think there's strong evidence, but it's certainly a great anti-inflammatory. I take a lot of herbal anti-inflammatories every day. As you may have noticed, I'm someone who is fairly hyped up. I take herbs to calm me down as well.
I suppose the other aspect of that is that could get quite expensive.
Yeah, not if you're a herbalist.
I suppose if you're a herbalist, probably extremely good value. But for those of us who are not herbalists,
Yeah.
I could just imagine that would quickly tot up.
Well, who can put a price on health?
Firstly, someone just can't afford to do that.
Do it by your diet.
What would be your stripped down regime for people who are not herbalists and can't take hundreds of things?
Be reluctant to recommend because I think it needs to be recommended individually. I would say improve your immunity by having 100 grams of mushrooms every day, and which I try to do. And that can be any mushroom because it's their fruiting body. 100 grams, fresh weight before you cook it. You can cook it anyway.
So what difference does it make whether you have it raw or cooked?
I think it's better to have it cooked because I think the beta-glucans are better processed by the body in terms of the immunological response if it's cooked.
Okay.
And chop it up fine. So I put it in my blender, turn it into a very fine mush, which I make as mushroom soup, because that gives you the maximal interaction of these beta-glucan structures in conjunction with cell membranes, and that's what optimizes your dectin-1 receptor response. So yeah, 100 grams of mushrooms every day, fresh crust clover, raw garlic, green tea every day, beetroots, well, particularly beetroot juice. Don't boil the beetroots because the nitrates will go out with the water, but eat the beetroots. Yeah, lots of turmeric and ginger and chili, black pepper as spices. The critical one is, of course, chocolate. Now, patients, they say, what? Chocolate? But we have turned it into a confectionery. Before that, it was a seriously good medicinal plant, and it's full of these polyphenolic phytonutrients that have a range of benefits. And this is being shown in multiple clinical studies across the board, brain health, vascular health, mood, all these sort of things. But it's how you have the chocolate. It's a minimum of 85% chocolate. So you're asking me about bitterness before.
Yeah.
That's one. I'll give it to friends if they come around to visit and they say, "Oh, I can't eat that. It's so bitter." It tastes sweet to me.
One thing I really notice, if I go through a period and I haven't eaten any sugar,
Yeah,
then when I have something that's got sugar in it, it feels ultra sweet.
absolutely. Yeah. So the other answer is eat a good, healthy diet, a Mediterranean-style diet. Comes up trumps in virtually every study. And in addition, if you can afford it, ginkgo biloba, high-quality ginkgo biloba at a certain dose, and a bioavailable curcumin product, because I think they're the best bet we have at the moment for preventing dementia.
That's been quite controversial, isn't it? Because some people have said that the studies of ginkgo, that the data is not that strong.
In what context?
In the context of preventing dementia.
In the context of preventing dementia, there have only been 2 studies. Both were flawed. There was the GEM study in the US that basically didn't follow people for long enough. Then there was the guide age study that was done in Europe that was better and showed some benefit, not overwhelming benefit, but shows some benefit. But again, both of these studies, have been too short, and compliance has been an issue in both studies, as it is in any longer term preventative study. There's no strong proof, but I'm basing it on the properties that we know of ginkgo. Its biological plausibility is huge in the context of what we now understand is going on in dementia. Let me tell you about this study. It was done in Germany, where ginkgo is often still prescribed by medical doctors, so they can track it via scripts. And they were looking at people who had mild cognitive impairment, which is potentially a precursor state to developing dementia. Not necessarily, but it can, certainly a higher risk. And the progression from mild cognitive impairment to dementia was halved in those people who had at least 5 ginkgo prescriptions.
And how much ginkgo were they taking a day?
That's where it gets complex. So you need, firstly, a really good quality extract. The original developers of ginkgo in Germany, their extract is what I might recommend. Also, the company I'm associated with, we do a good quality ginkgo extract. You need about 120 milligrams a day of that concentrated ginkgo extract, I believe, for prevention. So that's what I do. Keeps you sharp too. So it's not as if at the end of the day, decades later, you get dementia and you think, oh, the ginkgo didn't work. You're getting benefit all the way along. That's the important point about these things. Everything I've recommended, you're going to get an immediate benefit. So it may not prevent cancer, it may not prevent cardiovascular disease, but you'll feel a lot better and you'll be healthier. So to me, it's kind of a win-win situation, because there's the prospect of disease prevention, and certainly studies for many of the things I mentioned that suggest that. But at the same time, you're getting immediate benefit and they're doing you no harm.
I think if you went into your average GP surgery and said you were thinking about doing this, there might be some skepticism. Is there any way you can see that herbalists such as yourself could work more closely within the conventional medical framework?
Only if they become more open-minded and less brainwashed by pharmaceutical companies. But that's not going to happen, is it? Patients come to me and they say all sorts of crazy things. And I say to them, look, I'm not a health extremist. I'm very evidence-based. It's not the same standard of evidence for drugs, but it's pretty credible evidence. And it's also biological plausibility, the things I'll recommend. I'm not a health extremist. And I wanted to put that aspect of herbal practice out there. So that's what's on my Facebook page. I'll give clinical study after clinical study. Twice a week, I post new clinical studies, largely related to herbs, but also other things. And I have a YouTube channel where I do videos and what have you. To be honest, if you've got a skeptical GP, the first thing I do is have a look at my Facebook page, have a look at my YouTube channel, get an understanding of what the credible face of this style of practice is.
If I put you in charge of the Australian healthcare system,
Yes.
what would you change?
That's something I need to think a lot about. On the face of it, I would say that there needs to be a better understanding of the value of diet in medicine. Medical doctors are doing social prescribing and lifestyle medicine, and many of them are doing that. I applaud it. You've got the College of Medicine is advocating that in the UK, and they're doing great work. But I think the message needs to be put out there broader. And what is lifestyle medicine? It's a fancy new term for old-fashioned naturopathy. Exactly as I was taught it 40 years ago by naturopaths is what they're now touting as lifestyle medicine. I would put a greater emphasis on prevention and certainly ultra-processed food that's full of sugar. I walk down whole supermarket aisles and there's no food there of any interest. And yet there are aisles of it. So I'm thinking, who else is buying that and consuming it? So very heavy education program about health because the vast majority of diseases can be prevented.
Well, I suppose it's true for any disease, isn't it? That if we're healthier, we'll probably do better.
Yeah.
I'm absolutely for solid evidence. If you look at some of the most successful drugs in the world, and successful, I mean in sales terms, I don't mean in treating the disease.
Yeah, yes.
Which there is almost no good clinical evidence that it works.
Liz, look, there's a case in point. I posted something on my Facebook page recently about paracetamol, and they now know that paracetamol, like your non-steroidal anti-inflammatory drugs, does cause gastrointestinal bleeding, does cause peptic ulcers, does cause kidney damage. The evidence is there from a UK study, and it barely works for arthritis. And you get most rheumatologists in a quiet spot, and they'll admit it barely has any benefit in arthritis.
I interviewed a pain specialist, a consultant in the NHS, and he did really interesting studies across all the painkillers. The painkiller with the highest risk of side effects is paracetamol.
Yeah, exactly. And in osteoarthritis with the lowest efficacy. So why are they still doing it? To me, that's the sort of stuff they accuse me of doing, and they're doing it. Baffles me that you've got paracetamol is frontline, dangerous and useless largely for osteoarthritis. It baffles me as to why Boswellia and curcumin that have abundant clinical evidence for benefit in osteoarthritis aren't being explored and used by doctors.
Interestingly, I interviewed somebody else on the podcast. We talk about the non-steroidal anti-inflammatories, and the only non-steroidal anti-inflammatory, which is actually genuinely anti-inflammatory, is aspirin.
Absolutely.
Because all the rest, although they have a lessening effect initially, they actually cause that inflammation to last longer.
Yes.
The only modern painkiller I take if I need to is aspirin. Curcumin, I think, works well. The difference between it and aspirin, I think it takes longer to work.
Correct.
So if you want something that happens instantly, I take aspirin. I do think aspirin's pretty effective.
Oh, yeah, absolutely.
But I find curcumin, give it a couple of days to kick in, and it works.
No, correct. Yeah, I would agree with those observations. The interesting thing about aspirin is it could be working on pathways that its effect on the cyclooxygenase pathways is short term. Its longer term effects are possibly by different pathways that are actually quite beneficial to influence, like HMGB1, whereas the ones that are just purely focused on COX, which were the new generation of drugs, if you inhibit COX, you actually impair the healing response of the joint and you degenerate the condition over time. So they're not disease modifying. On that score, there was a clinical trial that was done on Boswellia, and Boswellia, they did it for 6 months. They gave people a placebo and Boswellia for 6 months. So naturally, within 1 month of stopping the placebo, the people's joint pain was back to where it was, or 2 months. 2 months after stopping Boswellia, the people were still getting an 80% benefit on their joint pain because it was disease modifying. You can see my frustration. The evidence is there. So after 40 years, I'm pretty grumpy about it.
Well, thank you so much for talking today. Really interesting and thought-provoking. Thank you.
You're welcome, Liz. Thank you.
Goodbye. Hope you enjoyed the latest episode of the podcast. And if you've enjoyed the podcast, if you could share it and leave a review on Spotify and Apple, I'd much appreciate it. It really helps. Many thanks for listening. Bye for now.